So you mentioned Liberty PAC. Is that the same as Liberty for All PAC? Because I'd read that there's a PAC in Texas that gave him
That's the one.
$660,000. That's the same one.
That one, yeah.
Okay, so
It's
Ron
owned
Paul.
by, actually it's run by his group, but there's a young man who inherited a lot of wealth.
Right,
He's
21
a
years
21
old.
year old,
Yeah, yeah, yeah.
and he's the one who spent all his money. So I'm sure he's getting donations from local people in town, but not much. I mean, if you look at my donation, I have like 800 people donated on my campaign.
Hmm.
And obviously, these are all individual donor. And now I'm getting my quote unquote support from the unions and getting a few thousand there and a few thousand there. And still, if you're in this room, so you can see that they're pledged, but they haven't sent the money yet. So I'm still waiting for them. But I'm very fortunate that I've been able to raise funds, and a lot of them now I'm getting funds from America, throughout America.
Well, that's what I was wondering
You know.
because, I mean, this was considered an unwinnable race at one point, and now it is a winnable race.
Right.
And I was wondering how much money you're getting from out of state.
Yes.
Are the national people getting behind you now?
What they do is they do not give you really cash in your hand, but they do your stuff. So, for example, they did a major poll on our campaign, and they paid $20,000 for that. So obviously that was a huge money. I could not spend 20 for a poll to see where I am. They did that, and then they had two staff come in to streamline our campaign.
Hmm.
They were here for 2 weeks, and obviously they moved on to another campaign now. They did elevate our race to a emerging blue race, and they acknowledged that part. And obviously I'm in touch with them, but most of the things we are doing is locally. I have my own advisors, I have my own TV producers who have done it. We are on cable right now since last week. From the first time they showed my ad was after the presidential debate.
Hmm.
But that was just a test case on CBS that showed that. But then now I'm on CNN, TNT, ESPN, Fox. I'm on some daytime channel with a lot of ladies and housewives are looking at whatever those are, Bravo and Cinema and USA and all those things. So hopefully I'm trying to let people know who am I, because that's more important. People, I mean, as far as a party candidate is concerned, in this election there will be party people voting. There's no question about it. But we still have a segment of our population who do not vote party line. They want to know who the candidates are.
Hmm.
So I have to tell them my qualities, what kind of candidate I am, what is my professional background is, how I have worked with people, what I'm going to bring it to our constituents here. So those things has to go. And you can only touch people for so many phone calls and so many literature pieces. So TV is the media. I mean, I'm so blessed that every newspaper have written good things about me. I mean, because you write, so you probably have read all those things. Even Detroit Free Press wrote a good article. Detroit News even wrote something good about me.
Which is surprising for the Detroit News.
Yeah, because normally they don't.
No.
And then, what's that? A Spinal Column. They wrote a good article on me, and then, Observer is in my hometown but I don't. It's only Canton, my hometown. But they did it in all the 7.
Yeah. My concern is that people are just going to go to the polls. I mean, part of the equation is knowing you, and part of the equation is knowing your competitor. And when he's hiding, and he's not going out and talking to people, and
I
he's
think
not,
that's what comes that you guys come into play.
Yeah.
That's where you have to bring him out of the woodwork, and this is what I talk to the guys. Even some of the people I talked to them today said he is doing it purposely.
Oh, sure. Yeah, definitely.
He has been told, do not come out, because the moment you open your mouth, you don't know how to defend.
Yeah. I mean, I've heard that from people that have run into him on the street and tried to ask him questions, and he will just not talk to them. I mean, he's trying to stay as low profile as possible.
Yeah, I was Surprisingly, I met him at Waterford.
Mm-hmm.
There's a senior prize luncheon meeting,
Mm-hmm.
and every candidate was asked to come, and they were given a table and said, you can go around and meet people in different rooms, or people can come and talk to you. Uh, there was a guy who came to interview me from Lansing, and so I was talking to him, and surprisingly, somebody from Free Press came and started talking to him. He was just angry, and within 15 minutes he left the building.
Yeah, it would be a shame if that strategy paid off, because I think there are going to be a certain number of people that just vote.
It will pay off definitely, because it's a presidential election. There will be the group who vote party line. They will vote for him. There's nothing I can do. But an intelligent person, which I have a lot of them in my district, they probably know more about him now, with the newspaper writing about him and things like that, and with my TV ad coming up. They have two options. Either they will skip to vote that seat at all, that they may not vote for either one of us. If they are Republican but they don't like the guy, they will not for either one. On the other hand, they may vote for me. And I know that there are a lot of Republicans who are voting for me. I know that part. But this is all under the table, because they are active in politics and things like that. People who understand politics. I cannot make the right understand me. There's no way I can do it. And I will not even go after them.
Well, you have, in your materials, you talk about, you stress a lot that you're, I don't want to, I forget your phrase exactly, that you're independent.
Yeah.
That you talk about your independence.
Voice.
An independent voice.
Voice.
So you're positioning yourself being a moderate Democrat.
Yes.
Democrat.
Talk to both sides.
Yeah. Well, could you talk a little bit about what you say to Republicans? That I mean, I assume you like some of their ideas.
Oh yeah.
What ideas do you like?
Pro business.
Yeah.
I'm a very pro business guy. I want business to come, because that's where our economy is going to improve. I want to give them tax breaks. I would help them bring the corporate tax level down. But I always add something with it. I want to stop the tax loopholes. But I definitely want them to compete globally, so that the tax structure, the corporation rate comes down. There's no question about it. The way I look at it is that businesses who are American owners and they have businesses abroad, I want them to bring those businesses back. And I want them to give them tax break for that, for the moving and all those things. I want to give them a credit here, that if you employ those many people, we give you tax credit for that. So there's a lot of things which I'm pro-business. But on the other hand, there are certain values of mine which I have to preserve, like Social Security, Medicare. People have earned it. People have paid into the system. I think that. And being a physician, I always talk about quality healthcare. I said every human being has a right to have affordable quality care, quality healthcare.
Well, as Mitt Romney just said yesterday, no one has ever died in the United States from not having health care.
He's lying.
Yeah.
Of course he's lying. And the reason is, has he ever been in a hospital or a doctor's office in his life? No. He doesn't know that. People see us at the end of their life because of having no health care.
When they come to the emergency room instead of coming to preventative. Yeah.
What happens that they don't have money, they are afraid of having a bankrupt because of healthcare issues.
Most bankruptcies are because of healthcare.
And what they would do is show up at the last lap of their life. That is because they never had a healthcare. If they have healthcare earlier on, they will not. My advice to people is have a healthcare, no matter what expense it is. We definitely have to lower down the cost of it, there is no question about it. But once you have the healthcare, you can get preventative care. And preventative care is so cheap. Once you would know about yourself, whether you have a high blood pressure, whether you have a diabetes, whether you have high cholesterol, you can take care of it. For lot of things, you don't need to really be on big time medication. You can do it by just changing lifestyle, knowing about yourself. Same thing with people with different age group. We can diagnose prostate cancer. We can diagnose colon cancer. We can diagnose woman cancers, and those are very, very treatable condition. Yes, there are still certain disease processes we have not achieved, and no matter what we do, there's not much you can do about it, especially some malignancies. Oh, but Romney is lying through his teeth. That much I can tell you.
Yeah, unfortunately, people will believe him. I think.
Oh, well, they will believe him because they believe anything they want, because they talk about it from early morning to night. It's the Russian style. You speak 5 times the same lie. The 6th time people would think it's correct.
Sure. Before I want to go back to taxes, but before we do, I have a question about healthcare. Obamacare has been rolling out over time. Okay, has been rolling out over time. You're starting to see that in your professional life.
Sure.
I'm assuming you see problems with it or things that you would change. I'm curious if you could talk a little bit
Well,
about
really, I mean, what happened that when the Obamacare was passed, it was passed in such a hurry that most of the people didn't know what is in it. And then they started implementing it in phases. And I think that's where the problem arose, because people did not know what the benefits are.
Right.
Now, since the benefits are there, people, some of the things which I always praise is that it's going to help us in the long run. It's going to save us dollars in healthcare, because every senior person from 2010 January had a free preventative exam with no copay and no deductible. So that was a good part of it, but nobody knew about it.
Right. And the same thing with not being able to be kicked off your parents' insurance and not being able to be refused for
Now
insurance.
they're saying, now pre-existing condition for children, that was major things for people who are employees, because they may not like their job, but they have a problem at home with a child sick, chronic illness. They're worried if they change their job, their child will not be covered.
Yeah, I've always thought that entrepreneurship would go through the roof if we had single payer healthcare in this country.
And that will help. There is no question about it. But what my philosophy is that every individual should have a healthcare. There is no question about it. In the long run, that's what's going to save us from bankruptcies, from disaster, people dying of lack of healthcare and things like that. So what I say, it's a nice blueprint for us to work with. Definitely we need some amendments done there. And now we don't need 61 votes to pass any amendments. We just need 1 vote extra, what is that, 50, 51. And if you have your vice president, even 50 plus him is enough to pass any legislation or amendments on that bill. So it's a nice bill. Yes, change is not acceptable by anyone immediately. I'm sure there's a lot of my physician friends not happy with that, because everyone is worried, oh my God, they are going to cut down our payment and this and that. Let me tell you, as a provider, there's a lot of wastage in healthcare. And if we can stop those bleeding, that will help insure other people. So it's going to bring, and I don't think it's going to, the way healthcare is going to be managed is a changing world completely. In the good old days, it used to be quantity, that the more you do, the more you get paid. It's changing world. It's going to go into quality. And it's no matter whether it's Affordable Care Act or no act.
Right. So how many people you keep from getting ill, you'll be rewarded for that instead of treating the people that are ill.
Yeah. So that's what it is.
I'm going to stop it and start it again.
Yeah.